New Mexico has one of the highest rates of uninsured citizens in the nation. Now, as it scrambles to meet deadlines under the Affordable Care Act, it faces the daunting task of reaching out to those uninsured to enroll them in Medicaid or in plans on the state exchange. With our large geographic area, scattered population, and high poverty in New Mexico, we face unique challenges, and advocates featured on our fellow New Mexico PBS program Public Square in July voiced concern that outreach efforts that relied only on traditional ad campaigns would not be effective here. But this week, a Wisconsin firm that holds a state contract to do advertising and public relations work promoting the exchange dropped its local partner, an Albuquerque advertising firm. Now, joining us to talk about this, one of our line regulars, Laura Sanchez, CEO of the New Mexico Green Chamber of Commerce, is back. We have a new face joining us this week, Rachel Sams, managing editor of the Albuquerque Business First. Welcome, Rachel. Good stuff. One of our regular panelists returns this week, Daniel Foley, former Republican whip with the State House. He's here, and reporter Russell Contreras of the Associated Press is back at the table this week. Great to have you here, Russell, of course. Now, Rachel, your colleague Dennis Domzalski has been doing some terrific work tracking this whole idea of increasing Medicaid rolls and also the healthcare exchange, the ACA coming up. But he also reported that I want to kind of tackle this first, that a local company here, G&G Advertising, was dropped by the Wisconsin firm I mentioned, who has the overall contract to get the word out, saying what they wanted to charge, our local firm, was going to be too much to get the word out to the Native American folks. Their complaint, the G&G folks, is that they got the bid because they had local partners. You can't just drop them. What's been the reaction to Dennis's story at your paper? What have you been hearing from folks on this?
We've definitely seen some folks in the community who are concerned when they see this this opportunity. The contracting that's available through the exchange is a big opportunity for New Mexico businesses, so they want to make the most of it.
7 million big.
Yeah, absolutely.
Right.
So people seeing some of these firms get dropped, this is actually the third firm where this has happened. There was a previous IT contract where a couple of local partners did not end up getting the work that they were expecting to get, had been signed on to get. So I think people are watching it. I think probably as more firms bid on future contracts for work with the exchange, maybe they'll ask for an upfront contract or that kind of thing, because this is the third time we've seen this happen. That's
true, and I wonder, this is another discussion for another time, but I wonder, where's the language in these contracts, Russell Contreras, that says if you do this, it's some kind of penalty or something? We'll take that one on another time. On this, we have a deadline approaching, however. In a very aggressive number we're trying to hit here of about 170,000 folks to get signed up here for health insurance. This is a big push for our state. What's your early take on how this is rolling out so far?
It's huge. It's huge. It reminds me a lot when I was in Massachusetts when Governor Romney implemented their health care reform there. It's the same thing. The key is getting the word out and the education out. It's a little different here in New Mexico because we have isolated communities that have serious health concerns. They are in communities where they've been marginalized. They have not had access to health care. And actually going to a reservation and saying the government is here to help you. We have an agreement here. Sign this. We're going to make these promises. You're going to get a lot of backlash and a lot of skepticism. So I think this effort, whether you're going to go to a local contractor or not, whoever gets it needs to know these communities and go out there and explain to them even some basic services. What are they going to get with this package, and be very upfront. And I think that is going to be the key here.
Interesting. Laura, good to see you again, by the way. As always, other states hate to do this sometimes, but other states have a very different approach to a big ad campaign with billboards and TV and newspaper. It's very passive. What other states are doing is sending people out on the road, literally going door to door, talking about what Russell was just talking about, getting a real granular feel for what the needs are, getting a baseline of services needed. Would that be a better approach for here? Or are we just too big for that, being the 5th largest state in the country?
First, in the interest of full disclosure, my organization, the New Mexico Green Chamber of Commerce, applied for and was awarded preliminarily a grant to do outreach and do some of the work that you're talking about to small businesses in rural New Mexico. So we do have a small grant that's pending that we're in the process of finalizing. But to your question, one of the distinctions about New Mexico compared to, say, Connecticut or Massachusetts, we have a much shorter time frame to get this all taken care of.
That's right.
One of the big issues is that Connecticut and other states have had much longer with the ACA, and their states basically structured to be able to plan for it. We didn't actually get the enabling legislation here for the health insurance exchange passed until this legislative session. So that means that we're talking about end of February, roughly, or March, in a 60-day session, till now to try to get all of that. So it's about a 6-month time period in terms of getting all these moving parts. So we've had to do it much faster, and I think the Health Insurance Exchange Board has done everything they can with their staff to get it done quickly. So what they've done here is they've, that advertising part is sort of one aspect of it, and then there's an outreach portion of it, which is the part that my organization is contracting for, as are several other chambers around the state, to talk to small employers about it. And the other difference too here in New Mexico is that we have a unique hybrid process. Other states like Connecticut, Massachusetts, most other states have done, they've either chosen to do the federal side of it or their state-based side,
Gotcha.
meaning that all the enrollment that will happen will be administered, and everything will be administered by the state or the feds. What we've chosen to do here is a hybrid approach where the business side of it is done by the state, but the rest of it is handled by the feds. So there has to be some communication between both sides, and we're actually only one of 2 states in the country that have chosen that hybrid approach, which the other one is Idaho. So we don't have a whole lot in terms of how they've done it to be able to rely upon as other states may have. So I think we're a little bit behind in getting our infrastructure set up for this, but I still think the opportunities are huge for enrolling a lot of people. And I did want to say that, concurrent with this, there's a push for Medicaid enrollment.
That's right.
So the Health Insurance Exchange won't actually be enrolling for Medicaid, but the outreach, the education that needs to happen will need to include information about the Medicaid options also for people who are eligible for that.
A lot of children involved and families
Right.
involved in that on that Medicaid side as well. I appreciate you making that distinction. Dan, we can forgive the board certainly for coming out a little rough on this. Laura makes a good point. They've had 6 months to put together probably the biggest thing in New Mexico modern times to affect so many people. Are we going to be forgiving here? Are we just going to roll with the punches as we go along? This is going to be a huge difficulty on the logistics of it. Are we ready? Do you think we're ready here?
Well, I think we could be ready, but I think they're screwing it up. I think bringing in someone from Wisconsin and expecting them to go up to Gallup and reach out to a chapter house and understand how to do that is a recipe for disaster. I think that once again, this is another example of the attitude in New Mexico of, well, somebody from out of state is better than us. We're going to spend all this money. We've got all of these people in this state that could have used this work. I don't mean to downplay the work. I'm not sure how hard an outreach program is. It's not like inventing a cure for cancer. I mean, put a plan together, get out there, get the message into people in Deming or to chapter houses or in, Kirkland or wherever it is. Who's better to understand that? People that have done this for years in New Mexico, whether they've operated political campaigns, whether they've done outreach for healthcare providers in the state. But once again, what do? We lump all the money into this giant super mega contract, and we let the super mega contract go. And of course, the only people that can help us have got to be from outside of New Mexico, because God knows we don't have the brain capacity with our own citizens to do this. And I think it's a huge snafu. I think they made a huge mistake, and I think they're going to find out that it was they could have managed this process easier by them being in charge of smaller contracts and saying this is how we're going to let this go than going to get someone out of state. I predict you're going to see a huge accountability problem in about a year where fingers are going to start getting pointed. We've seen this, whether it's the behavioral health, whether it's the people overseeing the third-party administrators of things like that. They all come from out of state. They got all these promises, and then when the legislature starts asking questions, people start saying, well, I've got to talk to the guy who's no longer here. He went back to Madison, Wisconsin, or
Let me ask you a
whatever.
question while I got you on a roll there. Is there any language you're aware of when we let out these contracts about dropping local partners immediately?
I don't think there is in this, but I think you can do that. You
Okay.
could say, look, I mean, I'm for the best people getting the job.
Sure.
We shouldn't be, we can go off into a tangent for an hour about whether you should be, whether a union shop's better than a non-union shop. All of that stuff is the best guy should get the work. This, to me, I mean, I'm not a rocket scientist, but if you're going to do outreach in New Mexico, the 5th largest state with a diverse population, I'm not sure how you can expect someone from Wisconsin to know how to reach out to people in New Mexico when you have people in the state that have made careers, lifelong business decisions doing that. And so I just think it's another example of this state, we don't trust our own folks. We got to go outside to get it done. But to answer your question, Gene, you can draft these contracts any way you want. They could have said, we're going to give an in-state preference. I think the exchange would have been better to take this mega contract, break it up into smaller pieces, and say, now I want someone that can go do this, someone that can go do that. By putting it in this giant contract, you eliminate these smaller businesses because they don't have the resources or the history. They might be able to do one aspect of it, but when you let out the contract that says, we're asking you to do 5 things, if you can only do 1, you're out.
Well, we have a song. There's a song. What's the matter with Be Well New Mexico? That's going to solve everything. There's a song. I mean, come on. We'll see
you
how
hum
this
it?
plays out. I think I'm on your side on this. I think it would have been better in smaller contracts, locally busted up, that's for sure. So we'll see how that plays out. In a moment, we're back with a discussion on the rain and flooding that swamped the state over the last week.